We're going to remove the calivarium and look at the internal aspect of the head, and in doing so we're going to cut off this with a saw, and we've put a string on here to indicate about where you should do your cuts, and you'll see that the line of cut would be about a finger's breadth above the top of the orbit, the brow, and that would extend back to about a finger's breadth above the corner of the ear here. And then make sure that you do your cut low enough, follow that line all the way enough so that you get low enough on the base of the skull back here. So we're going to be doing this with a hand saw, and it's just a matter of starting out and putting a score in the bone and then following that all the way around. Okay. Now, as you can see, I've made a cut all the way around the calivarium where the string was. The calivarium will still not come off. You can see that it's movable here, but the dura is bound down to the undersurface of the bone. Now what I'm doing is I'm just offsetting the calivarium just a little bit so that I can slide my chisel up between the dura and the bone so that I can scrape it off. Put a little pressure on it. All right, we've broken the adhering dura off the inside of the calivarium, and you can see that we've had a tough time of it in this body because there's still plenty of dura adhered to the inside of the skull. This will be variable. Sometimes it's very easy to get off. Sometimes it's a little more difficult. Now, after you've removed the bone, you'll be looking at the dura. Perhaps one of the first things you should just look at is some of the surface anatomy here. And you can see that there's a vessel coming up from the temporal region, and it's spreading out all over the dura. And in fact, if you look at the inside of the skull, you can see that it has actually made a groove on the inside of the skull. This is the middle meningeal artery that you saw on the infratemporal fossa. It's coming up to give a blood supply to the dura, and it's actually placed between the dura and the bone, and hence the reason for those furrows. This makes it liable to injury when you have fractures of the bone. The vessel itself can also be fractured, and hence you get some bleeding between the dura and the bone. This is an epidural hematoma. The next step in the dissection is to cut the occipital bone back here. So I'm going to make a wedge-shaped cut behind the ears going down towards the spinal cord. So I've made my saw cuts now, as I indicated before, and after you make the cuts you really have to again pry the dura off of this portion of the bone, and that allows you to remove it. Prior to removing this bone, make sure that you've completed your laminectomy down here, because all of the cervical vertebra, the lamina of all the cervical vertebra, should be removed up until this point. And as you can see here, we have a smooth transition of the dura covering the spinal cord right up onto the dura covering the brain. So the next step in the dissection is actually going to be to visualize some of the structures now internally. And to do that, I've already done a little bit of cutting from the saw along here. If it's still intact, you can cut the dura along here, cut it all the way back to about the level of the ear so that you can pick it up and reflect it off. So I'm picking up the dura, and of course what that leaves underneath is a layer of arachnoid. So all of this filmy material that you can see right here is arachnoid, and ordinarily the pressure of the cerebral spinal fluid would keep that arachnoid layer up against the dura. So I'm pulling away the dura, and as you pull it away, it'll be very easy to pull until you come to the midline, because don't forget, as we pointed out before, running along the midline up here is going to be the superior sagittal sinus, and it's a dural venous sinus, and the reason that we can't pull the dura away is because the veins, which ordinarily are underneath the arachnoid, are going to be returning blood that has gone to the brain, and they will pierce the arachnoid and then pierce the dura, so that you can pick up several small veins in this region. Just look really closely and you'll see some of the veins coming in. So in order to fully pull the dura away, you're going to have to break these connecting venous structures. Okay, so I'm doing that now. So I've put my probe in, running all of the way, and now when you separate the two hemispheres of the cerebrum, you'll see that the dura, okay, on this side, the dura, after I pull it away, is seen to extend in between the two cerebral hemispheres. And this structure is called the falx cerebri, and it extends from anterior at the level of the frontal bone all the way back to a structure called the falx cerebri. So look at that. It's a structure which helps to stabilize the brain. Obviously, having a septum down in between these two cerebral hemispheres will prevent them from moving in this sort of a direction. Okay? Now I'm going to cut the anterior extension of the falx cerebri up here, and that's going to allow me to remove the falx coming back. I'm going to have to extend my cut on this side back just a little bit, so I can do that. So I'm pulling it up, and I can pull it back to about the level of the ears. And once again, you're going to see lots of these cerebral veins coming into the area where we have the superior sagittal sinus. So I'm going to cut those and pull back to this level. Now we're looking at the occipital lobe of the brain. And the falx cerebri has extended all of the way back. Don't forget, it's in this sort of an orientation. And then it's going to meet a membrane which is at right angles to it, also formed of dura. And when I pull up the occipital lobe, we're looking down into this shelf, which would be right down in here. Now, I've got the tentorium right here. You can just see that. I know it's a little hard to see now, but when we get the brain out, we'll be able to see in a little better detail how these dural reflections are arranged. But I am cutting the anterior aspect of that horizontal sheet, and now I'm going to continue the cut down towards the spinal cord. So I'm just cutting dura right here so that I come down to the level of the spinal cord down here. And now I'm going to continue the cut that you made originally in the spinal cord. I'm going to continue that up to the cut that I just made coming down. So the two will meet. There. And if I've freed everything up, that is going to allow I didn't cut there. Now the tentorium has been cut free, and you can see that that tentorium rests between the underlying cerebellum, which is down here, and the occipital lobe of the brain. So it's a horizontal shelf going in that way. And now I'm going to remove it from both sides and sort of pull everything down so that I can pull it from there. So both sides now have been freed up, so that the brain is ready to be removed. And we will now take a look at some of the anatomy which is related to the last part of the spinal cord and the intersection with the brain. Now we're looking at the last extent of the spinal cord as it approaches the foramen magnum. I've cut already the dura away, and I'll be able to reflect that almost entirely out of the way. We can see some of the filmy arachnoid, which is right here. And as a matter of fact, in this region, we're just on the inside of the foramen magnum at this point. It forms a cistern, that is, the arachnoid actually pulls away from the underlying neural tissues and forms a fairly large reservoir of CSF right in this region. Now I'm going to break away the arachnoid from the surface of the spinal cord and also from the surface of the brain here and get it out of the way. And there are a number of structures which become fairly readily evident. One structure is right here. This is an artery which has made its way up along the side of the vertebral column, the vertebral artery. And what it does now is it takes a very sharp turn, and at this point it is going to pierce the dura so that it can make its way up to the brain. And here's a portion of it right here. You can look and see a vertebral artery on either side. In many cases they are asymmetrical, so that we won't look for the one on the other side, but it may be substantially larger or smaller than this one. The other structures that we're going to see at the very top of the vertebral column, you can see this white structure right here. That white structure is what you saw lower down. That's an extension of the pia. That's your denticulate ligament. And of course, coming dorsally over the denticulate ligament will be your dorsal roots. Okay? Now, the last portion of the last dorsal roots I've broken away because it allows you to see a small artery, a small nerve, which is arising from the upper part of the spinal cord, but in fact it is a cranial nerve. This is cranial nerve 11, the accessory nerve, and these are the rootlets of the accessory nerve coming off of the spinal cord. You'll see they come off in an intermediate position, that is intermediate between where you see dorsal rootlets coming off and ventral rootlets. They're basically coming off the side of the spinal cord right here. And this nerve, which is formed by the aggregation of these small rootlets, is going to extend up through the foramen magnum as the spinal accessory nerve. So here is the spinal accessory nerve coming up right here. Okay? And now we're looking at the back of the spinal cord. It's at its intersection with the brainstem at about the foramen magnum. There are a number of structures here you should be familiar with. These are our dorsal roots because we're looking at it from the dorsal side. And this white material that you see right here represents the last part of the denticulate ligament. And this large structure right here is the vertebral artery. It's coming in medially. It's going to pierce the dura and give blood supply to the brain. Now, one of the things that we've done that you should not do is I've removed a portion of the medulla so that you can see some of the anatomy right here. Now, there's a very important nerve. This is cranial nerve 11, the spinal accessory. It comes from the spinal cord and it courses up through the foramen magnum and heads towards the jugular foramen right there. And as it approaches the jugular foramen, it is joined by rootlets of cranial nerve 10, multiple rootlets coming off here, and then finally a smaller glossopharyngeal nerve, all heading towards the jugular foramen, which is located right here. And then slightly cranial to that, we have two more nerves. There's a large one right here and a smaller one next to it. Actually, another one down in here that you can't quite see. Those are 7 and 8, cranial nerves 7 and 8, the auditory nerve and the facial nerve. So as you're removing the brain, what we would like you to do, first of all, don't remove the cerebral hemisphere, but as you're picking up the brain and peering in and seeing these nerves, we'd like you to cut them about halfway between the brain and where they exit from the skull. The way that you would actually do this is I'm going to cut laterally along the spinal cord to cut all of the ventral and dorsal rootlets as they go down to form the spinal nerves. Okay? You're going to pick up the stem of the spinal cord. Now you can see, look at this very, very large vertebral artery. It's actually quite asymmetric, so that in this case it is asymmetric. You can see the one on the other side is smaller than the one on the left side. So cut those on either side. And then, in a way that I indicated before, you're going to peer up through here, and any of the nerves that you see extending between the brain and where they exit from the skull, cut them about halfway. Last structures to be cut are going to be the arteries. That's the internal carotid on either side. Cranial nerve 3 is there, and then if you extend the cut superiorly, you'll go through the optic chiasm and the brain will come out. You have the opportunity to look at some of the stumps of the cranial nerves which are left behind, and we'll do that now. We've already seen the spinal accessory nerve, number 11, as it came up from the spinal cord going up towards the jugular foramen, and that's it here. And then just anterior to it, we have the vertebral artery on this side, and I'm just going to pull it aside a little bit because if it's a long stump like that, you have to look under it in order to see the fibers of the hypoglossal nerve, which are right here. There'll be multiple fibers going out through the hypoglossal canal. By following the spinal accessory nerve up, it'll lead you to the jugular foramen, and there will be numerous nerve filaments here because cranial nerves 9, 10, and 11, the glossopharyngeal, the vagus, and the spinal accessory will all exit from this foramen. Now the next is a little bit superior and anterior to the jugular foramen, and this would be the internal auditory canal here. Cranial nerves 7 and 8 will pass out through here, and obviously they've been broken away as we remove the brain. 7 is the facial nerve, and 8 is the auditory and vestibular nerves, which will go out through here. Now, we're working our way anteriorly, and the next is cranial nerve number 6. It will be found on this sloping portion of the occipital bone here, and a little bit closer to the midline. This is the abducens nerve, and it's entering the dura right here. Slightly anterior to that will be another foramen, and exiting through this little foramen, or actually a fairly large foramen, will be the trigeminal nerve, number 5. Now 4 is kind of hard to find. 4 is the trochlear nerve, and what I have here, this is the free edge of the dura as it forms the tentorium cerebelli. And in the region of 5 and 6, you look across here, and there will be a very, very small filament that you can see right here that enters the free edge of that dural sleeve, and that is the trochlear nerve right here. Slightly anterior to that will be a much larger oculomotor or third nerve, which you can see right here. Now, in this region, we have a number of structures which you should look at in addition to the oculomotor nerve, which is right here. Just anterior to that will be the internal carotids as they've come up. This would be the area just inferior to the circle of Willis, which would be on the brain right up in this region. So we have the two arteries here, and in the midline we have a fairly large stalk. This is the pituitary stalk, and the pituitary will be left with the dissection here. It's in a pit surrounded by dura, and that's what keeps it in place. So this is the stalk of the pituitary, and then just anterior to that will be the optic nerves. The optic chiasm may be present depending on where you've cut it. So we have two optic nerves right here. This would be cranial nerve number 2, and then finally you have to look on the brain basically to find the olfactory tract, and at this point right in here in this depression we have what is called the cribriform plate through which the olfactory nerves will be exiting the skull. We'll now look at the arterial supply on the base of the brain. The two major arterial supplies are of course from the vertebral system, which is here. You can see the two vertebral arteries coming up. Don't forget, it's not unusual to see asymmetry here. One can be much larger than the other. And the other supply is coming up from the carotid system, so this would be the internal carotid here. So these will be connected via the circle of Willis, and we'll look at that anatomy right now. So we have the two vertebrals coming up, and they're going to join to form one vessel in the midline going up along the brainstem, and that's the basilar artery. And this artery will come up and then bifurcate to give rise to two large arteries, which are the posterior cerebrals. And they're just shown right here. And you can see coming from the cerebral and going anteriorly is going to be a small branch right here, which is called the posterior communicating artery. And it is going to be a passageway for blood between the vertebral system and the carotid system up here. So it's connecting those two systems. That's the posterior communicating artery. Here we have the carotid system right here, and it is going to give rise to a middle cerebral artery shown going off here in this direction. Can you see that? Good. Here. And there will be a second artery coming off from it going in an anterior direction, and that will be the anterior cerebral artery coming up in this direction. Now, in order to see those anterior cerebral arteries, you're going to have to break away some of the arachnoid so that you can separate the two cerebral hemispheres like I'm doing here. And you can see the anterior cerebral on one side and the other. And if I take my probe and pass it down between those two arteries and then pull up, you can see that there's a small communication between the two of them right at the tip of the probe there, and that would be the anterior communicating artery, so that it would be just connecting the two anterior cerebrals. So taken together, as we go from the basilar to the posterior communicating to the carotid to the anterior cerebrals, we have our other communicating in the front, we get to the other side. This constitutes a full circle, which is called the circle of Willis. At this point, we're going to look at a little more detail at the dura, some of its reflections, and the sinuses, which are encased within the dura. We've already looked a little bit at the superior sagittal sinus. You can see it coursing along the midline going posteriorly. And we've also considered the veins that we saw on the surface of the brain here beneath the arachnoid as they pierce the arachnoid to gain access along the length of the superior sagittal sinus, so that this blood, which enters the superior sagittal sinus, will course posteriorly back along the superior sagittal sinus to an area in the back of the brain here, which is called the confluens. And it is called the confluens because it's receiving blood from several sources. That blood, as it is going to leave the skull, will now go in a horizontal direction. This is called the transverse sinus. And then finally enter a sinus here which goes deep along the petrous pyramid to course down towards the jugular foramen, and that is called the sigmoid sinus because it has an S-shaped. So that the blood which is coming back to the confluens will be bifurcating and going right and left so that it can come out both the right and left jugular foramen. The next thing that we'll take a look at is we'll reflect the dura, and then I'm going to remove one cerebral hemisphere so that we can see interior reflections of the dura. And we've already seen a little bit of that in the sense that we saw the falx cerebri as it came down between the two cerebral hemispheres, and of course it helps to stabilize the brain from movements in this direction. Now the falx, as it comes back, is going to change direction and form another structure which is called the tentorium cerebelli, so that this is coming across in a horizontal position, and it is going to separate the occipital lobe from the underlying cerebellum, which is still in place down here. Okay? Now, on the inferior edge of the falx cerebrum is another dural venous sinus. It's actually really very small, but it also comes back and it's going to be emptying blood to the confluens. And the second major structure, which is also going to be contributing blood to the confluens, is derived from a very large vein which comes off of the bottom of the cerebral hemispheres. It's called the Great Vein of Galen. It's going to enter here, and it courses back in what is referred to as the straight sinus, and you can see that flows back at the intersection between the falx and the tentorium. It also flows back into the confluens. So that all of this blood, though, as it comes to the confluens, will then go to the transverse and then the sigmoid sinus.